Okay, let's talk about HIV, human immunodeficiency virus. What is it and what does it do? Well, we have HIV, the human immunodeficiency virus, and we have AIDS, which is the acquired immunodeficiency syndrome. Now, there are people we call the carriers. We call them people living with the virus. They just have the virus, they are not sick. The fact that you're tested today and you test positive to HIV does not make you come down with AIDS, does not mean you are an AIDS patient. It means you are just living with the virus. Now, if it was discovered early and then medications commenced immediately, you could live your normal life, fulfill your days without coming down with HIV illnesses for once. It means you will not have symptoms. Normally, HIV have 4 different stages: stage 1, stage 2, stage 3, stage 4, and each of those stages have their separate symptoms they present. Now, for each of the stages, the CD4 continues to decrease and the viral load continues to increase as these stages increase. Now, at stage 1, your CD4 is still high, relatively high, and then your viral load is though high but not that high. And then at stage 2, your CD4 further reduces with the viral load further increasing. At stage 3, your CD4 crashes with your viral load further skyrocketing. And then at stage 4, in most cases, it is the terminal stage. At that point, your viral load is over the roof, actually. And then your CD4 in most cases is crashed beyond expectation. So when you are told that you are HIV positive, people begin to reject it. It's not my portion. It's not. I reject it. My pastor said it's not this. My pastor said it's not that. But the truth is it there? Is it not there? If it is there, my sister, forget about what the rejections are. Forget about what anybody had said. Forget about whether it's my portion or not your portion. The truth is that it is there and something has to be done. If it is in the blood, I will advise you, go to another health center and get yourself tested again. Let's see if it is the same positive you would get. If you get the same positive result, then it's positive. If you get a negative result, then I will advise you get a third opinion. When you go for a third opinion, whatever that comes up with will now determine what the problem is. You can continue until you are sure. But once you have 2 agreeing results against one, it's obvious that that is actually the result. That thought experiment or that thought testing is what we call the tiebreaker. I'm saying this because there had been people who had been wrongly diagnosed of HIV, and then they've started medications only for you to later on discover that they are negative to HIV after they have started taking medications and some harm have already been done. Because I tell you, those drugs are not smiling. Yes. Because even when you're exposed to HIV, we give you those drugs as pre-exposure prophylaxis. And when you take those medications, there's a lot you will feel, even though you're not yet down with the syndrome. Although, for those who are already down with the problem, they may not have a lot of those symptoms. But you, whose immunity is still high, and then you start taking them, in fact, it throws you off balance for a while. And you will take them for a month. So now imagine somebody who doesn't have this disease and has been commenced on drugs because he was wrongly diagnosed. And this is why I'm saying, please get yourself tested. Not because you want to just claim the disease. No, nobody claims any disease. Just get yourself tested to be on the safer side, so that in case of an emergency, somebody will just give you a sickness that is not yours. In an emergency situation, a lot of things are being done. A lot of tests are being carried out. So let them know at that time mistakenly say it is positive when it is not. Yes. So in order to rule out all that, you need to get yourself tested today. And once it is positive, please ask them, what's the next thing? I need to have my CD4 count run. I need to check my viral load. I need to know if I'm to commence medication immediately. Some people have medications for free, And then no matter your level of CD4 count or viral load, once you're positive, you are commenced on medications. And in some places, they tell you we have a benchmark, we don't have enough medications, so we give to those who are mostly in need of it first. So you find out what's operational wherever you are, and then commence your treatment as quickly as possible. Stay negative to HIV. Thank you.